Welcome back to the channel. Today, we're talking about a medical emergency that sends hundreds of thousands of Americans to the ER every year: renal colic, the painful result of kidney stones blocking the urinary tract. If you've ever heard someone say it's one of the worst pains a person can experience, they're not exaggerating. Renal colic happens when a kidney stone obstructs the flow of urine, typically in the ureter, the tube that connects the kidney to the bladder. This blockage increases pressure inside the kidney and triggers powerful muscle spasms as the body tries to push the stone down. That's what causes the intense wave-like pain renal colic is known for. Most patients describe the pain as sharp and sudden, usually starting in the flank, that's the side of the lower back, and radiating toward the abdomen or groin. Unlike constant pain, renal colic tends to come in episodes. It rises to a peak, eases briefly, and then returns with force. That cycling pattern is a classic clue for doctors. But the pain is just the beginning. Many people experience nausea, vomiting, restlessness, or sweating because of how the body reacts to the intensity. You might also notice blood in the urine, a frequent urge to urinate, or burning when trying to go. If fever or chills occur, that's a red flag for a potential infection and requires rapid medical attention. So why do these stones form? In many cases, it's dehydration. When there's not enough water in the system, minerals like calcium or uric acid can crystallize and clump together. Diet and lifestyle play a big role too. High sodium intake, excessive animal protein, sugary drinks, and low fluid consumption all increase risk. Genetics, obesity, certain medications, and underlying conditions like gout or hyperparathyroidism can also contribute. When someone comes in with suspected renal colic, the diagnosis usually starts with their symptoms. From there, the most common imaging tools are non-contrast CT scans and ultrasounds. Blood and urine tests can help detect infection, blood in the urine, or underlying metabolic issues. Treatment depends on the size and position of the stone. For smaller stones, typically under 5 millimeters, the goal is to help the body pass it naturally. That involves drinking plenty of water, taking anti-inflammatory pain relievers, and sometimes using medications that relax the ureter to speed passage. For larger or stubborn stones, procedures like extracorporeal shockwave lithotripsy, which breaks the stone into smaller pieces, or minimally invasive endoscopic removal may be required. In severe cases where the kidney is at risk, a stent or other urgent intervention might be needed. Once the immediate episode is under control, prevention becomes key. Staying hydrated is the #1 strategy. Most urologists recommend enough water to produce at least 2 liters of urine daily. Reducing salt, moderating protein intake, and avoiding excessive sugary beverages can significantly lower the risk. For people with recurring stones, doctors may recommend a metabolic workup and diet adjustments based on stone composition. The bottom line is this: if you or someone you know experiences sudden intense flank pain that comes in waves, don't try to tough it out. Renal colic needs proper evaluation, because fast treatment can prevent complications and reduce suffering. If you found this breakdown helpful, hit that like button, subscribe for more medical insights, and drop your questions in the comments. Thanks for watching, and we'll see you in the next video.